Myself, I'm Dr. Namdev from India. My question to Dr. Burt, you mentioned about the critical shoulder angle, but usually what is my idea regarding the critical shoulder angle is it is related to the excessive osteophyte formation at the anterior and lateral aspect of the acromion. But how to differentiate this critical shoulder angle between the young patients with a rotator cuff tear and the degenerative rotator cuff tears? Do you have any idea regarding this?
Could you repeat how I differentiate between young persons with rotator cuff tear and?
No, usually the critical shoulder angle, this
Yes.
increased critical shoulder angle is because of the osteophyte formation. Okay. But sometimes if a patient with suppose 40-year-old patient with a cuff tear, maybe post-traumatic, comes for a surgery, in that case, I feel it is unnecessary to do this anterolateral acromioplasty. So what is your take on this?
Yes, I have to admit, I don't have a routine measuring the CSA before I operate my patients. And I agree with you, if I have an acute tear in a young patient, I don't measure and I don't do acromioplasty.
Yes, okay, thank you.
Yes. I want to ask Dr. Guliash, do you have experience with oral cortisone treatment?
No, sorry, we don't do oral steroids at all.
So you mentioned that in the patient who is willing to go non-operatively, you start with the physiotherapy and giving intra-articular injection steroid, and you think that will fasten the phases from freezing till frozen. I mean, any evidence behind that? Because we usually give it with just for pain control. We don't aim to fasten the phases, or just as experience, or I'm not sure really.
It's no real evidence under that. It's what we see is like that. So it's if you give a steroid, it gives you a chance to take the patient from freezing to frozen, and that's just a chance. If normally you don't see the patient as a shoulder surgeon, you don't see the patient in the freezing phase. You normally see the patient in the frozen phase. So it's really hard to get a big group of people to study that. Thank you.
Again, on the critical shoulder angle, is there any differentiation when you have an isolated subscale versus a isolated posterior tear? Does it make a difference? Or?
There's not so much literature on this, and the studies I presented was not subscap tears. It was supra or infra. I have a question for Julius. When you have this patient and you do the arthrolysis, have you ever seen that they have get a luxation afterwards? A shoulder dislocation afterwards? Because you mobilize them and they don't move their shoulder a lot. Because we have had lately 2 cases referred from other hospitals. They have been doing arthrolysis, and they have not recognized that the shoulder has been dislocated. So we have got them after several weeks, and that's a huge problem. You haven't experienced that?
That can be a huge problem. We haven't experienced that. When it's really important to emphasize that we're doing that in primary frozen shoulder. If you have a secondary, so post-traumatic or something like that, when the patient has a dislocation, after that has a frozen shoulder, we never do an arthrolysis because of the higher rate of instability. We haven't actually experienced acute dislocation after arthrolysis.
So you don't do X-rays routinely after?
No.
Do you want us to finish to be on time?
But with older patients, and in my experience, it must be very rare because I don't remember to have a dislocated shoulder after arthrolysis. No. Such an aggressive reaction that even after arthrolysis, they still become stiff after that, and we have to follow them and start rehabilitating them immediately, giving them motion.
Yes.
You
But
have a
the reason
patient
I
very
asked
stiff.
is because we
Yeah.
just had 2 cases.
Yes.
And I think the patient was sent home at the operating day with a dislocated shoulder. And they hadn't been using their shoulders for months. So
Yes,
they
but-
didn't know
yeah.
what to expect.
Probably if you examine the patient the next day or day after that,
Well, these
you
surgeons
you are
didn't.
going to realize that
Yes.
there is no motion,
Yes,
and this
yes.
is going to be an alarm signal.
Yes.
So,
Any more
So-
questions, or should we finish up?
Yeah, this concludes this first session. We hope you all enjoyed it. So now we can proceed. Thank you.